Hey, Dr. Stile here again, and I'd like to spend a few minutes talking to you a little bit about the implants that we use for breast augmentation surgery in my practice. I exclusively use Mentor implants. I have for the last 20 years that I've been performing this type of surgery. The most common questions that I'm asked by patients are, number one, what type of implants do I use, saline versus silicone, or what profile would work best for me? Over the last 20 years of performing this surgery, what I have observed are certain consistent facts that are associated with good outcomes. Picking the right style implant is key in getting them closer to their desired result. The three profiles that have been commonly used are moderate, moderate plus, and high profile. Right here on this implant stack, these three implants are approximately the same volume, but have different profiles. The moderate implant is a wider and flatter implant. It will give you less projection when put into the patient's body. Previously, I've used this implants for patients with wider chests and possibly even broader shoulders because they could accommodate this and it would fill up the space, give them some semblance of cleavage, and not give them what was previously referred to as a rock in the sock appearance. One of the most commonly used profiles I do use is the moderate plus. The moderate plus implant is narrower and has more projection. The moderate plus implant is one of the implants that I most frequently use and seems to work well with most body types. The high profile implant is actually even narrower in terms of its base diameter and has more projection. This implant, the high profile, seems to work best on my smaller patients who have a narrower chest diameter. It is also an implant that seems to work best for patients who desire a more high fashion outcome as well. Most recently, the Boost implant has an even higher profile for the same base diameter, believe it or not. So if you look at the high profile versus the Boost, you'll see that the Boost actually gives you more projection. Lastly, silicone versus saline implants. Saline implants were almost exclusively used when I first started practice back in 2004. There was a moratorium on silicone implants because there were some concerns that they might contribute to various illnesses. Research and exhaustive studies were performed that confirmed that this was not true, and the moratorium on silicone implants was reversed. Now, my practice almost exclusively uses silicone implants because it's what patients want. Silicone, cohesive gel, and gummy bear are all terms that patients seem to use interchangeably when referring to this type of implant. The correct term is cohesive gel. What that simply means is if this implant was cut in half, it does not have a liquid in it that would just spill out. It has the consistency more similar to a paste, and that's why it feels more like natural tissue once placed in the subpectoral or subglandular position on our patient's chest. Whether you select cohesive gel or saline implants, your outcome will be excellent as long as you are a candidate that's suitable for this type of procedure. The first step is scheduling a consultation. Having a physical exam and measurements taken and a discussion of what your expectations are is the foundation for everything that will follow. I look forward to hearing from you and seeing you during your visit. Be well.